Dendreon's a little gem. We are an immunotherapy company, first in the country to get approved in immunotherapy by the FDA.
Dendreon's primary goal is to service our patients. We come in every day looking to prolong the lives of the patients that are impacted by the diseases that we service.
We have a commercial product called Provenge to treat men with prostate cancer. We take cells that are apheresed from the patients. We ship them overnight to the manufacturing facility, and then we treat them over a 2-day period, and then we ship them back to the patient. The cells that we give the patient then upregulates their immune system, which then allows them to fight the tumor in a very, very natural way.
We have very strict timelines on expiry for our patient material. A couple of weeks ago, we had some cells that got on a late flight and got delayed, and we literally ran. Once the courier dropped them off, we ran to get them on test so that we could meet the timeline. When you treat someone's cells who's counting on you this way, you do almost anything to help them get their therapies on time.
We can figure out how to develop the product to allow it to be manufactured in an efficient manner. And the efficiency is not about COGS.
We weren't looking for an MES in the traditional sense, in the sense that our product is very manual. So we weren't looking for a software that can control machinery, pumps, so forth and so on. We were really looking for a paper documentation system in an electronic format. Removes paper from our clean room. And clean room paper is very hard to sanitize. There's an associated bioburden with that, and that just adds risk to our process and our ability to keep our product safe.
We want the cells to go back out to our patients only if they meet specification. If they don't meet specification, they're not helping our patients. So it's really important that all that data is available at our fingertips in order for us to make wise decisions based on our registration and our requirements that are in our BLA. Our batch records, as you know, is patient specific, so we don't manufacture in lots or in batches. And so we have all of our ranges validated for our specifications within our MX solution. It's pretty efficient in batch record review because you don't have to have an individual who's checking all the values to the ranges manually. You have the system that you validated, and it can just come in and do that work for you.
Review by exception really cut our review time in half, and then it's also enabled us to monitor batch record closures now that those processes are automated. You now have the ability for people in Seattle, in Atlanta, in Los Angeles to kind of work together and collaborate on a same document at the same time.
We didn't see a huge change in the manufacturing processes itself. It's all the peripheral activities that surround that manufacturing process that were really streamlined, if you will. A big metric that we track is the handoffs. Is the product where it's supposed to be when it's supposed to be there? Is it moving to the next phase of the manufacturing process at the right time? So not only right first time, but right on time.